off, we were talking about women's heart health and how they present differently, specifically after menopause. So what happens when a woman's experiencing heart issues?
Yeah, so we know that women will tend to present still honestly with chest pain, so we don't want to forget that. But at the same time, women will often present with more than one symptom, which can sometimes make the diagnosis more challenging. So they'll more often have symptoms like shortness of breath, maybe they'll have some nausea, they'll have palpitations, headaches. Now, it's not to say that all of those symptoms mean you're having a heart attack. I don't want people to misconstrue that. But, as opposed to men who will more commonly have just that sort of classic Hollywood heart attack with the chest pain, heaviness in the middle, women will tend to present with chest pain and these other symptoms. So it's important to pay attention. Now, the most important thing, though, is, again, that ounce of prevention, getting checked out, looking at your blood pressure, women or men or whatever your gender is. These are the things you can work on before you get to the point of having a heart attack.
Speaking of prevention, I'm switching gears to a totally different demographic. Teens, you're seeing vaping on the rise.
Yeah, absolutely. When you look at, I think you were talking about that earlier, but up to 25% of high schoolers are now vaping. Now, I don't want to put vaping and cigarettes on exactly the same level. We know that cigarettes are extremely harmful and one of the most significant risk factors for heart attacks and strokes. But we are starting to learn some of the very ill effects of vaping on the lungs. And we were talking about during the break, we don't know that 10-year data or 20-year data for vaping. And so, there are concerns that it causes high blood pressure, lung problems, and so the point is, if you're smoking something, it's not good for you.